Good afternoon, and welcome to the May 22nd Community Update. My name is Stacy Wood, and I serve as a Public Information Officer here in the Emergency Operations Center. And before we get started today, I'd like to acknowledge and thank our emergency services personnel during EMS Week. Their assistance and expertise continues to be a huge asset to Buncombe County's COVID-19 response. This community update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's community updates will come from Dr. Jennifer Mullendor, the Buncombe County Medical Director and Interim Public Health Director, Brownie Newman, Chair of the Buncombe County Board of Commissioners, Esther Mannheimer, Mayor of Asheville, and Fletch Tove, Buncombe County Public Health Preparedness Director. And we will get started with Dr. Mullendor.
Good afternoon. I wanted to start out by updating everybody on our current statistics related to COVID-19 in Buncombe County. As of this afternoon, we are up to 216 cases of COVID-19 in Buncombe County residents and 7 deaths associated with COVID-19. Our cases continue to disproportionately impact individuals of color who often serve as essential workers and live in larger household sizes where the infection is easily spread. Over 4,300 tests for COVID-19 have been performed in Buncombe County residents. COVID-19 testing remains available through primary care practices, as well as through Mayheck Family Health Centers of Biltmore, Range Urgent Care, and Mercy Urgent Care's 4 locations in Buncombe County. This past week, unfortunately, our community testing sites were canceled due to inclement weather. Our plan is for testing sites to be at the following locations on the following days next week. So on Tuesday, May 26th, we'll be at 52 Cox Avenue, downtown Asheville. On Wednesday, May 27th, we'll be at the Sandy Mush Community Center. And on Thursday, May 28th, we'll be at Deaverview Apartments. Testing each of these days will run from 1 to 4 p.m., and language services will be available. We ask that those individuals who have health insurance bring their insurance card, but there will be no out-of-pocket costs for any individual who receives testing that day. And again, these dates are subject to change depending on the weather. The new guidance from the state recommends that healthcare providers ensure that the following individuals or populations have access to testing. It would be anybody who has symptoms suggesting COVID-19, and again, those symptoms have expanded to include cough, shortness of breath or difficulty breathing, fever, sore throat, headache, chills, and a new loss of sense of smell and taste. Others who we want to have access to testing for include close contacts of known cases of COVID-19, individuals who live in or have regular contact with high-risk settings, so those working or living in long-term care facilities, homeless shelters, correctional facilities, people who are at higher risk of severe illness, so individuals over the age of 65, or those of any age who have underlying health conditions, those who come from historically marginalized populations, healthcare workers or first responders, and frontline and essential workers in settings where social distancing, physical distancing, is difficult to maintain. So we are working with our local medical community to make sure that they have access to testing supplies, if they're able to do testing in their own offices, and if not, that they know where they can refer their patients to for testing. Don't forget that the Buncombe County website has a self-checker tool that you can use to assess whether or not you may have COVID-19 based on symptoms. And the self-checker can help you get connected with locations where you can get testing. So COVID-19 and its impacts are unpredictable. And our main priority now is to prevent further harm to our residents, to our economy, and to the fabric of our community. Let's continue to work together to act for the greater good and to trust in each other to do the right thing. The transmission of COVID-19 is primarily through respiratory droplets. And transmission largely occurs in the first 7 days after infection, when many people don't know that they're sick. So cloth face coverings work by reducing the amount of infectious droplets that are in the air when someone speaks or coughs or sneezes. And face coverings are primarily designed to protect the others around you from transmission of the virus, should you have it. So if the wearer of the mask is infected with COVID-19 but is unaware of it and could spread it to others, we want to make sure that they're wearing that mask. Wearing a mask or a cloth face covering is not a replacement for practicing physical distancing or for practicing hand hygiene. And if we do all these things together, wear our face covering, keep our physical distance from others outside our immediate household, and wash our hands, that's how we're going to prevent the spread of COVID-19 in our community. So a few pointers on how to put on and take off your cloth face covering. So your face covering needs to cover both your mouth and your nose. Tie it behind your head or use ear loops and make sure it's snug. While it can be hard, you don't want to touch your face covering while you're wearing it. And if you do end up touching it, make sure to wash or clean your hands with hand sanitizer. Remove your face covering by untying it or lifting it from the ear loops without touching the front of your mask or your face. And again, you want to wash or clean your hands after you remove it. You can wash, and you should wash your face covering with soap and water regularly, and it's fine to wash it in the washing machine with other clothes. And a few other things, precautions related to face coverings. We shouldn't put face coverings on anyone who has trouble breathing or is unconscious or otherwise unable to remove the mask without assistance. and we should not put face coverings on children under the age of 2. And again, don't use face coverings as a substitute for social distancing, hand washing, or staying home if you're sick. The pandemic is a moment when change is inevitable for better or the worse. Change is possible, and we all have a role in moving our communities' health and safety in a positive direction. As I said yesterday, what life we knew in 2019 is not coming back anytime soon. And if we act like we're still living in 2019, we will continue to see more cases and more deaths. So we don't want to go back. We don't want to go in the wrong direction. And as we move into phase 2, we need to realize that this is not necessarily a one-way street. That if things don't go well in our state or locally, there is always the potential that we have to go back to more restrictive guidelines. So we're here now because of the hard work that you all have done. So let's continue to follow the guidance and to continue to do the things we've been doing. Caring for others, making sure that older adults and those who have underlying health conditions, those who are most vulnerable in our community, stay protected. And I know it's a long weekend for some of you, and it's a weekend where typically we have celebrations and cookouts. But again, we're in the middle of a pandemic. COVID-19 is still here. We need to not forget that. And we need to remember that every action you take has a consequence. And that it is crucial that you continue to practice the physical distancing from others outside your household, to wash your hands, and to wear your face coverings. Thank you, and stay safe.
Good afternoon. Before I make a statement, I'd like to acknowledge some of the other elected officials that are with us at this media advisory. County Commissioner Anthony Penland, Jasmine Beach Ferrara, Amanda Edwards, as well as Sheriff Quentin Miller, Mayor Esther Mannheimer, who we'll hear from in just a moment. And we also have the City Manager, Deborah Campbell, and the County Manager, Avril Pender, and as well as County Commissioner Al Whitesides with us today. Thank you all for being here. At our County Commissioner meeting yesterday afternoon, the commissioners agreed to support a policy requiring the use of face coverings for indoor, public-facing businesses such as retail stores and restaurants. The governor's policy announced earlier this week already required face coverings for certain close contact businesses such as barbershops. This was not an easy decision, and I'd like to share my reasons for supporting this policy. North Carolina is entering phase 2 of the reopening process, which will allow more commercial activity, most notably indoor restaurant dining. This is an environment where 6 feet social distancing alone may not always be completely effective in preventing the airborne transmission of COVID-19. The science is growing that indoor environments where people spend a prolonged amount of time are most conducive to the transmission of this disease. Many local businesses that want to consistently enforce a policy requiring face coverings in their indoor space to protect their employees and their customers asked the Commission to adopt this policy. Their point is that they are in a much stronger position to make this happen if they can communicate to their customers that this is not just their personal preference of the individual business, but is a community policy. This is the main reason that I supported this policy. Anecdotal observations and some community surveys indicate that while the use of face coverings has grown tremendously over the past 8 weeks, we can do better. Many constituents who work in local businesses have observed over the past month that people who have traveled to our area from outside of Western North Carolina wear face coverings at a lower rate than residents of Buncombe County. It is important that people who visit our area take the practical step of wearing face coverings when they are frequenting our local businesses to protect the health and safety of our workers and residents, especially since many who have COVID-19 are asymptomatic and do not know they have it. This was not an easy decision. I value personal liberty. In normal times, a policy like this would not be up for consideration. For these reasons, I support this as a temporary policy to help provide an additional layer of protection as North Carolina enters phase 2 of the reopening. While the science strongly supports the public health benefits of wearing a face covering while in a crowded indoor environment, we know it's not practical or necessary in all situations. Face coverings can be removed when people are in restaurants while they're eating. Not all employees will necessarily need to wear them, as many have roles that involve little interaction with the public. Churches and other houses of worship are exempt. The policy will not go into effect until next Tuesday, and the county is acquiring a supply of face coverings to help provide more to people who do not have any. Many have asked about enforcement of this policy. There are many states, cities, and counties that have these types of face covering policies in place already. The general approach that has been taken, which the Commission supports and the order reflects, is that individuals who do not wear a face covering are not going to be cited by law enforcement. Law enforcement and first responders have higher priorities to address. Nevertheless, the jurisdictions that have done this have had higher levels of participation in wearing face coverings. So we believe there will be a public health benefit in terms of suppressing the spread of COVID-19. Businesses that choose to consistently enforce this policy on their property to protect their employees and customers have the legal right to do so, and we should support them. Mayor Esther Manheimer and I have discussed this issue extensively over the last week. She has spoken with all the members of the Asheville City Council, and they support this approach as well. This afternoon, I will sign a local order to adopt the face covering policy and other aspects of the Phase 2 policy. The face covering policy will include Asheville and Buncombe County. The other municipalities in the county are planning to continue to encourage the use of face coverings, but it will not be a requirement in those jurisdictions. These are no easy decisions, and I respect each jurisdiction's right to make their own decisions on this question. I'm now going to sign the updated order. And I'd like to ask Mayor Esther Mannheimer to join us to make a couple of remarks.
Good afternoon. Thank you, Chairman Newman. I'm encouraged by the data reported by the North Carolina Department of Public Health, as most key indicators are moving in the right direction. But we must remain vigilant and not let our guard down as we continue to try to flatten the curve. Today, the city of Asheville is joining the state and the county in moving into the Phase 2 of the reopening plan. As the stay-at-home order is lifted and people return to public spaces, it is more important than ever to follow public health guidelines. The 3 W's: wear, wait, and wash. Our continued success is dependent on our adherence to these guidelines to decrease the risk of spreading the virus. We know that the work we have done thus far has led us to this point, allowing businesses to reopen with limited capacity, allowing us to gather in small groups, and allowing the opening of most public spaces and parks. But we also know that the risks remain. This virus has not disappeared. Before, we imposed, along with the state, a stay-at-home, stay-safe order. In Asheville, you did a great job with complying with that order. Now that the restrictions are being lifted, and it is anticipated that folks will be more out and about, we are asking you to wear masks in indoor commercial spaces. We are imposing this mandate because we know that it can help flatten the curve and keep those around us safer. Wearing a cloth mask is an effective way to reduce the spread of COVID-19 by people who have the disease but don't know it yet. This is a simple step we can take to help our neighbors, our friends, and our family to make sure our community is safer. Let's continue to move forward and work together to slow the spread of COVID-19. Thank you.
Good afternoon. I'm Fletch Tove, Buncombe County Public Health Emergency Preparedness Director. Buncombe County will be entering Phase 2 of reopening today at 5 p.m. Our local trends and metrics, although not ideal, support this deliberate and measured step. As we enter Phase 2, it is important for everyone to understand that this phased approach can move in both directions. It's an adaptive response. This means that later in the year, if trends or metrics are unfavorable, we may make the determination to move us back a phase or to implement enhanced mitigation measures once again. Please do not be dismissive of this statement. It is very possible that later in the year, we may need to re-implement various forms of restrictions. Our local data will determine this. So how can we all work together to prevent this? We take the guidance and recommendations from public health officials seriously. We acknowledge that physical distancing, the use of face coverings, and good hand hygiene are still our best tools to slow the spread of COVID-19. We work together to protect our loved ones and the most vulnerable. We ensure that our businesses, workplaces, and social groups are taking the necessary steps and have the necessary resources to help our community respond, adapt, and overcome this global challenge. While we maintain individual liberties, we also have a shared responsibility for the welfare of all. So now let's talk through our new Stay Safe, Stay Smart order together. Similar to entering phase 1, we are adopting Governor Cooper's Executive Order number 141, alongside the state's FAQ document for phase 2. There are a few areas where we would be more restrictive than the state, and a few areas where we have enhanced guidance. I'll get to those in a moment. But first, let me speak to the general changes we will see in the transition from phase 1 to phase 2. First, the stay-at-home order will be lifted as we move to a safer at home recommendation. This means that we should still try to stay out of public areas and public spaces as much as possible when we don't have pressing needs or purposes, but it is now just a recommendation, no longer an order. Mass gathering guidance has changed. We were at no more than 10 persons, either indoor or outdoors. That guidance has now changed to 10 persons for indoor gatherings or up to 25 persons for outdoor gatherings. This mass gathering guidance does not apply to retail, restaurants, and other businesses whose limits are based on maximum emergency occupancy. This guidance applies more to social events such as group meetups, hobby groups, or groups of friends getting together. The 3 W's still apply. So you should wear a mask, maintain 6 feet of physical distancing, and wash your hands with increased frequency. Worship, religious, and spiritual gatherings, to include weddings and funerals, and other First Amendment activities, are exempt from the guidance in this order. However, receptions, visitations, or events after the immediate wedding and funeral are subject to mass gathering limits of 10 persons indoors or 25 persons outdoors. And again, the 3 W's are strongly encouraged. Several business sectors are now able to open at 50% capacity and with specific constraints and requirements. This includes restaurants for dine-in service, salons, barbershops, tattoo parlors, and other personal care services, and pools. Those specific constraints and requirements are detailed in the attached Governor's Executive Order 141. There are still several sectors that must remain closed. These include, but are not limited to, bars and nightclubs, museums, playgrounds, gyms and fitness studios, to include indoor yoga, cycling, martial arts, CrossFit, and dance studios, and indoor entertainment venues, to include movie theaters, bowling alleys, bingo, and music halls. Now let me talk about where Buncombe County will deviate from the state guidance. For leisure travel, lodging, and booking, hotels, motels, beds and breakfast, and short-term rentals, and homestays and campgrounds may now book and schedule leisure travel reservations with no restrictions on location. The occupancy of these lodging establishments, if an establishment has greater than 10 units, they are limited to 50% capacity. Establishments with 10 units or fewer may book up to 100% capacity. All lodging establishments must wait 24 hours after a room becomes vacant before cleaning and disinfecting. And the cleaning of these rooms must comply with the guidance outlined in Executive Order 141. Organized sporting events at Buncombe County facilities are not permitted in Phase 2. And we are aligning with the state's guidance for restaurants with the exception that food service establishments shall not allow self-service operations to customers. Finally, as Chairman Newman and Mayor Manheimer mentioned, we have a mandate for face coverings. Now, face covering is defined in the attached Executive Order 141 and must be worn by all persons 12 years of age or older in all indoor public commercial facilities, including libraries and public transit. However, a person who does not have a face covering will not be prevented from riding public transit. This provision applies to these establishments and will go into effect at 7 a.m. on Tuesday, May 26th. Now I'll list some provisions where this, or some situations where this provision does not apply. While dining in a restaurant, for reasons related to an individual's medical condition, disability, or religious beliefs, in private offices, in areas of retail establishments, businesses, or restaurants that are not open to the public, when complying with the directions of law enforcement officers, during any worship, religious, or spiritual gatherings, funeral ceremonies, wedding ceremonies, and other activities constituting the exercise of the First Amendment, and in settings where it is not practical or feasible to wear a face covering when obtaining or rendering goods or services. This failure to use a face covering in indoor public commercial facilities shall not constitute a criminal offense. To close, COVID-19 is still a highly contagious virus present in our community, and we are still in the midst of a global pandemic. We know, without a doubt, that this reopening will result in more positive cases and more deaths. It takes all of us working together to minimize these consequences to the greatest extent possible. We do that by following public health guidance and safeguarding our communities. Our response continues to be driven by data, science, and fact. As always, let's be safe, let's be smart, and let's take this step by step. Thank you.
In closing, we wanted to make you aware of an important event on Tuesday of next week. Next week, representatives from the North Carolina Department of Public Safety, the Racial Justice Coalition, and the Buncombe County Sheriff's Office will be speaking about the ways that Buncombe's justice community is mobilizing to keep inmates and courtgoers safe during COVID-19. This virtual event is on Tuesday, May 26th from 1 to 2 p.m., and more information can be found at buncombeready.org. We will provide the next community update on Wednesday, May 27th at 2:30 p.m. And all of the information that was referenced in today's community update can be found at buncombeready.org. Thank you for staying engaged, and let's try our best to stay safe over the weekend. Thank you.